Our good friend Dr. Joe Congeni from Akron Children's Hospital Sports Medicine Center. And Joe, speaking of Sports Medicine Center, our buddy LeBron, high ankle sprain. He's had ankle sprains. I don't know if he's ever had anything this severe. They're saying he's going to be sidelined for a month. Why don't you take it from there?
Yeah, you're right, Ray. I think you're absolutely right. I did look up last night some of the injuries that LeBron has had in his career, which has been pretty he's been pretty injury-free and pretty healthy. But he's had, it seems like, typical lateral ankle sprains, we call them, the ligaments on the side of the ankle. But I don't recall a significant high sprain. And it really is people that have seen the clip on social media, it's made the rounds and things like that. It's the exact mechanism of what makes high ankle sprains different. Instead of just rolling the ankle, which is the typical ankle sprain we've seen for years, this is an injury where the ankle rotates and twists while it rolls, and a very large ligament that's between the two lower leg bones, the tibia and the fibula. That's the ligament that tears with a high ankle sprain. And the problem with this ligament, it has a lot of blood vessels in it. It has a lot of nerve endings in it, so it's extremely painful. So I come back, we're covering a game, and you see a kid rolling around on the field in terrible pain and screaming out in pain and things like that, and they've rolled their ankle and twisted their ankle, and then pretty likely that it's a high ankle sprain. People reach to the calf area, and a lot of other people, I think even in this injury, a lot of people say, oh, could that be an Achilles or could that be a lower leg injury? But actually that's kind of pretty typical for a high sprain. And we tell coaches at least twice as long as a typical lateral sprain. So a typical sprain, 1 to 3 weeks. A high ankle sprain, more like 3 to 6 weeks or longer. So, yeah, it'll be interesting to see how long it takes LeBron to come back from this injury. But, it made me, again, with him being a son of Akron, Ohio, and following his career, like everybody in the country has, but we followed it a little bit closer here in Northeast Ohio. He's 36 years old, I believe, 18 years in the NBA, Ray. Amazing statistic to me that I found last night. 94% of games that he's been able to play in without injury. 94% of games in his 18-year career. And he's never missed a playoff game due to injury in his entire career. So that's pretty amazing. But I think we do remember some of the injuries that he has had. He's been very injury-free. Number one was that poorly timed injury to the right elbow in the playoffs in 2010. Remember where he shot left-handed and everybody wondered how bad that elbow injury was, and the Cavs got knocked out of the playoffs. Do you remember that one?
I do, for sure, yeah.
Yeah. Number two, one that I think goes down in probably the big four injuries that I came up with that he had was the broken or badly bruised hand that he had when he hit the whiteboard in the 2018 after Game 1, the game where the Cavs had a chance against Golden State and blew the game at the end, and he had the broken hand, played the rest of the series. Actually, in one of those games, he had a high number of points, 38 points with the injured hand, but he played with the injured hand. Number three was, of course, the groin injury the first year in L.A. He missed some time with that, and since they weren't making playoffs, he took some time off with that injury. And now here with the high ankle sprain, we'll keep an eye on if this derails their chances in the 2021 playoffs. Those were probably the four biggest injuries, but 94% of games that he could play, that's pretty good for an 18-year career. And so I wanted to mention, people ask me sometimes, what can you do to prevent injuries? And there's really three things I'd say. Number one is really working hard on strength and flexibility and injury prevention. And they say with LeBron, he's second to no one in how well he takes care of his body in trying to prevent these injuries. And so he's done a pretty darn good job in 18 years. Number two is it's partly genetics, the way you're made. There's some bad genetics in people that I see in my office that predispose them to having injuries the way they're made. And then there's other people, the way they're made, they really have have the ability of preventing injuries. And he is obviously a genetic freak, really, have been able to be on the side of staying healthy. And number three is one that's just really hard to quantify, is toughness. How tough are people to play through injuries? And I think LeBron has proven in a long career that he's pretty tough playing through injuries. So those are some of the things that I looked at last night. He's been pretty durable. He's only had a handful of injuries. Those were the big four injuries, some of which we lived through here in Cleveland, that I thought of last night. It'll be interesting to see how he deals with this high ankle sprain, as they are only about a month or two away from the playoffs.
You know, Joe, I was talking to some friends, and I compare LeBron to Jerry Rice years ago out of the NFL. And, you know, LeBron's ability to stay on the court was like Jerry Rice's ability to stay on the field. And it is also their regimen of working out and the different ways that they stay in shape. They realize that their body is their profession. And I think LeBron has spent so many days and hours and emotions in sculpting that body and getting it in for his profession. It's enabled him to stay on the court. Jerry Rice used to do the same type of thing.
You're exactly right. And some injuries that have shortened or ended careers for other athletes, he just really, like, for instance, he had a year or two there of some pretty bad back spasms, if you remember. And for a lot of people, you know how that will end the career after all the many, many games that NBA players play, or all the difficulty of NFL players like Jerry Rice. But he just would not let that be. And from what I understand now, the back is hardly a problem for him, again, just because he's so relentlessly worked at getting himself healthy and keeping himself healthy from what would be an injury like a pretty significant back injury. Just done an incredible job, and there's several athletes like that. Remember, though, genetics play a role in this as well.
All right, Joe, great information this morning, my friend. Thank you again for the time, and we'll catch up next Wednesday.
Sounds good, Ray. Have a great week, okay?
You too. There you go. Dr. Joe Congini joins us Wednesdays at this time from Akron Children's Hospital Sports Medicine Center.